There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, how should I take care of a person with high blood pressure? Answer by Suprajit Das. If you've been diagnosed with high blood pressure, you might be worried about taking medication to bring your numbers down. Your lifestyle plays an important role in treating your high blood pressure. If you successfully control your blood pressure with a healthy lifestyle, you might avoid, delay, or reduce the need for medication. Here are 10 lifestyle changes you can make to lower your blood pressure and keep it down. 1. Lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep, sleep apnea, which further raises your blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. Losing just 4.5 kilograms can help reduce your blood pressure. Besides shedding pounds, you generally should also keep an eye on your waistline. In general, men are at risk if their waist measurement is greater than 40 inches, 102 centimeters. Women are at risk if their waist measurement is greater than 35 inches, 89 centimeters. These numbers vary among ethnic groups. Ask your doctor about a healthy waist measurement for you. 2. Exercise regularly. Regular physical activity at least 30 minutes most days of the week can lower your blood pressure by 4 to 9 millimeters of mercury, mmHg. It's important to be consistent because if you stop exercising, your blood pressure can rise again. If you have slightly high blood pressure, pre-hypertension, exercise can help you avoid developing full-blown hypertension. If you already have hypertension, regular physical activity can bring your blood pressure down to safer levels. The best types of exercise for lowering blood pressure include walking, jogging, cycling, swimming or dancing. Strength training also can help reduce blood pressure. Talk to your doctor about developing an exercise program. 3. Eat a healthy diet. Eating a diet that is rich in whole grains, fruits, vegetables and low-fat dairy products and skips unsaturated fat and cholesterol can lower your blood pressure by up to 14 millimeters Hg. This eating plan is known as the Dietary Approaches to Stop Hypertension, DASH. It isn't easy to change your eating habits, but with these tips, you can adopt a healthy diet. Keep a food diary. Writing down what you eat, even for just a week, can shed as surprising light on your true eating habits. Monitor what you eat, how much, when and why. Consider boosting potassium. Potassium can lessen the effects of sodium on blood pressure. The best source of potassium is food, such as fruits and vegetables, rather than supplements. Talk to your doctor about the potassium level that's best for you. Be a smart shopper. Read food labels when you shop and stick to your healthy eating plan when you are dining out. 4. Reduce sodium in your diet. Even a small reduction in the sodium in your diet can reduce blood pressure by 2 to 8 millimeters Hg. The effect of sodium intake on blood pressure varies among groups of people. In general, limit sodium to less than 2,300 mg a day or less. However, a lower sodium intake 1,500 milligrams a day or less is appropriate for people with greater salt sensitivity, anyone age 51 or older, anyone diagnosed with high blood pressure, diabetes or chronic kidney disease. To decrease sodium in your diet, consider these tips. Read food labels if possible. Choose low-sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Just 1 level teaspoon of salt has 2,300 milligrams of sodium. Use herbs or spices to add flavor to your food. Ease into it. If you don't feel you can drastically reduce the sodium in your diet suddenly, cut back gradually. Your palate will adjust over time. 5. Limit the amount of alcohol you drink. Alcohol can be both good and bad for your health. In small amounts, it can potentially lower your blood pressure by 2 to 4 millimeters Hg. But that protective effect is lost if you drink too much alcohol, generally more than 1 drink a day for women and for men older than age 65, or more than 2 a day for men age 65 and younger. 1 drink equals 1 proof liquor. Drinking more than moderate amounts of alcohol can actually raise blood pressure by several mechanisms. It can also reduce the effectiveness of blood pressure medications. Answer by Leanne Heisey. If possible, help them to adhere to taking their meds as prescribed. Have their blood pressure monitored as recommended. Alternately, buy a validated blood pressure monitor for self-monitoring. See the list on Dable Educational Trust vertical bar monitors for self-measurement of blood pressure, SBPM, and regularly measure their own blood pressure, which should be less than 135/85 of a millimeter. Hg for home measured value. Change their lifestyle accordingly, especially not smoking. Here are some thoughts on measuring blood pressure and diagnosing hypertension. Measuring blood pressure is another problem. Many people who on one occasion had too high a blood pressure didn't have it when blood pressure was taken at a later moment. We call it white coat hypertension. In the large Australian therapeutic trial in mild hypertension study published in The Lancet on 14 June 1980, they found that even after 3 measurements of too high a blood pressure 504, 12, 8%, of the in total 3,932 participants had a blood pressure below the inclusion range at the 4th, 5th etc. measurement, so weren't that hypertensive at all. So before treating high blood pressure, just make sure it really is too high. Usually the first measurement is falsely high. We repeat measuring blood pressure until we have 2 measurements within 5% of each other, the mean of which we consider the right measurement. You can help your doc by measuring your own blood pressure at home using a validated blood pressure monitor, following the recommendation above, and writing the measurements down. Answer by Abhishek Ghosh. Omron 7130 is cheapest model I know, which is European Standard Past. Here is chart of validated devices. Dable Educational Trust. 2,500 Indian rupees. Amazon. Sell after 2 years continuous use on OLX and buy another new. First reading discard. Then 3 records and average of them. I really cannot say properly till I know the values, age, gender. These are standard sources.